Good morning, everyone. So, welcome to Journal Anatomy. And today is day one. And today we'll be learning the language of anatomy. Not only the language, but we'll be talking about so many other things. One interesting suggestion which came just before few minutes I was reading it. A question was asked that other YouTube videos, why don't you say that if you like this video, please share and then subscribe and press the bell icon? Well, it is not necessary. It's not necessary. Means with due respect to you, because you are there, say quality matters, right? So a good quality audience like you, that is far better as compared to just collecting a group, right? So no need. This is like we are a group. Let's study. Okay. So moving on to this first part, general anatomy. Now see, because this is the first session, this is the first touch to anatomy. So we'll actually go into the detail. Yes, we'll talk about the books. We'll talk about the books. So what I'm telling is that as we'll be talking about anatomy, and today is the first session, right? So we'll try to enter into the anatomy in such a way that till the end, till we finish our anatomy, it should be so interesting and we should be able to remember it very crisply, because this is one of the topic which is for foundation, right? It is a foundation topic. So that's why it's of tremendous importance. Now see, when it comes to the word anatomy, right? Very interesting, right? This is divided into two parts, right? Ana means to see, and Tommy means to cut, right? So this is where you cut and you see, right? This is basically a Greek word which came from the word anatome, right? Anatome. Now, when we study anatomy in general, right, regarding say what you are talking about, that histology, but yes, histology and everything will come. Don't worry about it, right? I know. So we'll take it. But first, when we talk about anatomy, how many types of anatomy are there? Now, we are talking about this because we'll be learning so many of the things parallelly, right? Why so? If we consider that, okay, anatomy means one, this particular PDF will be shared, right? Like our every session. Let's make few things clear, right? First, don't keep on asking questions again and again about the books, right? I will automatically keep on telling you whenever it is required. First thing. Second, if someone has asked one question, to kindly see the chat, because then the chat will unnecessarily be flooded with the same question again and again, right? Regarding the books, yes, we'll talk about it. Second, when we are understanding one particular concept, it is very much advisable not to break the link in between, because when the link is broken in between, it affects not only me, but it affects everyone whosoever is focusing and trying to understand it. Many of the emails, they were like, sir, I was tempted to ask the question in chat, but because the topic was going on, so I never interrupted. Well, that is so thoughtful of you, right? The third thing, not once but every time, our notes, that is in the form of this pdf would be shared, because whatever I am writing, I'll keep on saving it, right? So you'll be getting the exact same pdf uh, in the form of link, and you'll be able to download it, right? So these are the three things, telling you in advance so that I don't have to repeat it. Okay, all right, so let's remove this part. Coming back to our anatomy parts, right? What are the types of anatomy? As, as I said, that there are several parts, right? There are several parts. We shall be learning these parts parallelly. And how? Just after 10 minutes, you'll automatically understand that yes, say for example, we are learning upper limb, but at the same time, parallelly, there are several other parts which will be running. So first thing, right? The first part, which is called as the cadaveric, which is the commonest one, right? Cadaveric. Cadaver means dead body, right? Dead body. So where the dissection is done, right? Where the dissection is done, and then we really watch various structures. Now in this, there'll be two things. One, regional. When we say regional, this means it is like upper limb, lower limb, thorax, abdomen, right? Then head and neck and brain. That's how the entire course is, right? That's how we study. But then there is the second thing, which is what is called as the systemic. Now in systemic, we focus on a specific structure. Say for example, osteology, that means bones. Say for example, myology, right? That is muscles. Angiology. So that means about the blood vessels, right? It is about the blood vessels. Regarding angio, I'll just say something. Whenever we'll be talking about, say, those blood vessels, say for example, we are talking about blood vessels of upper limb. In any of the series which is already on this channel, but and we'll be discussing again also, but our aim will always be from heart to heart. That means what? We start our journey, though we are discussing say upper limb, but we shall start our journey with the heart, that okay, this is the aorta, and this is one by one all the branches which will be taken, and then all the way you reach to the say capillaries, and then those capillaries again form, they become vein, and then those veins join with each other with their tributaries, and finally it lands back into the heart. This gives you the complete picture. So whether we are discussing upper limb or lower limb or thorax or abdomen or head and neck or brain, will actually know that the blood is passing through which area and then it is landing into which area. Finally, the entire circulation. It will matter the most when we'll be discussing some of the pathology, because you will know that these are the collateral circulation. These are the path. That means if the path is blocked at one point, that means there'll be pooling of blood over here and there will be no blood over here. So it means that blood has to pass through some other channel. That is what is called as the collateral circulations. So automatically you'll start understanding those collateral circulations very effectively if we learn by that method. So that is where we go for integration, correct? That is though we are learning upper limb, but in systemic, we are learning the angio also. Similarly, when we are dealing with arthro means joints, right? So where we'll see the stability. Neuro, that means these are the nerves which we are talking about. And then there would be a big area, that is what is called as I'll write it in capital, it is called as the splanchnology. Logy means science, right? Splanchno means organs. Now this comprises of all the organs, right? So whether we talk about say respiratory system, we talk about the alimentary system, digestive system, we talk about endocrine system, right? So all of them, they'll be part of it, right? Cardiovascular system, right? Heart, yes, that's right, right? So they'll be part of it. So this is what is called as cadaveric. Had the body been given to you in real dissection, so you will be if you are cutting, you are opening the thorax and then you are studying heart. So you are learning regional and systemic together. So this is first. But in real life, right, you are doctors. You will be doctors. So cadaveric is just for understanding in real life. That is what is called as the living anatomy. Now in this living anatomy, I'm about to write 4 words, and those 4 words will be of utmost importance when you'll be dealing with the patient. Make this habit right from the beginning to remember these 4 words. Inspection. Inspection means you are watching the patient, right? Inspection. Then second is palpation, right? Patient tells that I am having pain in this solar plexus, right? So you just touch and you try to feel, right? Percussion. Percussion. Say for example whether the liver is enlarged or not, right? In medicine we'll be discussing it at length, but you just put the finger and then you tap, and there would be specific notes, right? If you really want to check it on yourself, just put and tap. The sound is different, and then you put it on abdomen, right? And tap, the sound would be different. Why? Because over here there is solid structure in abdomen, there are hollow structures, so there will be tympanic, there will be vibratory sound effects. So put the this long finger near to the surface, and just as if it is a hammer, right? This is a wrist movement, it is not this, it is a wrist movement, right, where it is tapping, and then that is what is called as the percussion. Right now just understand it, right? You can try it on yourself, but it is one of the very interesting topic, long topic, which we'll be discussing in yes, dull voice, if it is solid. Especially say on the liver, when you'll see, you'll find a dull note, right? Percussion, and then auscultation. Auscultation is what you hear with your stethoscope, right? So that is inspection, palpation, percussion, and auscultation. These are the 4 things. Plus, in living body, you do endoscopy, right? Endoscopy. So in modern medicine, there is endoscopy. So whether it is a bronchoscopy or it is a colonoscopy, or right, it is gastroscopy, right? So you just put that fiber optic, you put the fiber optic camera, right? On the tip there is fiber optic camera with the light source, and then you really see everything on your screen, right? So inspection is just to watch, palpation is touch, you touch and try to feel, percussion when you tap, right, and try to hear the note, that what type of, whether it is a dull note or it is a vibratory note, and auscultation is what you hear with your stethoscope, right? So in auscultation there would be heart sounds, there would be breathe sounds. You also hear the borborygmi. Borborygmi is the sound which is when you touch on, when you keep it on your abdomen, and if you have consumed, if you have eaten anything, and then you hear all those sound of secretions, right? Very interesting. The third one, which you'll be learning in detail, the embryology, right? Embryology. Embryology is tremendous visualization, tremendous. So where you actually see the complete prenatal development, that is before birth, what are the things, how the whole thing is getting developed, right? In this, do remember two words, right? One, what is called as the ontogeny, right? Ontogeny. Ontogeny. I always write it like this. This is 0, right? It is 0. So this means this shows development from 0. That is right from the beginning, the entire development. That is what is called as the ontogeny, right? That is called as the ontogeny. When it comes to one more word, which is called as the phylogeny. Now, phylogeny is more or less like a research, right? It's more or less like research. It is like evolution, that how the Adi Manav was there, and then how it developed, and what changes came, etc. We shall be interested in ontogeny, right? Evolutionary, that's right. That is the evolutionary history, exactly. It is like evolutionary history. I'm taking important types first, right? The fourth one, this would be just superb. As someone wrote, before also, this is the surface anatomy, right? Because every time you cannot say, patient tells that I'm having severe acidity, you can't say, chalo so jao, let me cut, see, and let me see how is your stomach doing and let me test how much acid is there. No, 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 you can't do that. Right? This is surface anatomy. Surface anatomy means this is without opening, you figure out that which structure is where. Because when you can do that, your differential diagnosis, this is another word, DD, or the differential diagnosis. Differential diagnosis tells that out of all the possible diagnosis, which one is the most probable? And that is where your surface anatomy will help you a lot. That is on the surface, on the skin, this structure will be representing how. Now say in Viva, this was carrying tremendous weightage because there would be cadaver and it would be said that okay, you do the surface anatomy, you do the surface anatomy of, let's say, spleen. So you have to actually draw that how the spleen would really look like, right, in the body, on skin, where exactly would it represent, right? So that is surface anatomy. All these things will be learning parallelly. Will be learning parallelly. Because say for example, if you want to take the pulse, how come you say, okay, let's take the pulse over here? You just touch that area and the pulse starts coming. Because surface anatomy tells that on the lateral aspect, you just put the finger, that is the distance, that is the point, and you get the radial pulse, right? So that is like surface anatomy. That artery is quite deep, but because there is a bone behind, there is a solid structure behind, and the artery is passing over it, and we are feeling the pulse under a solid structure, so that's why it can be felt very easily, right? That is where the surface anatomy will be coming into picture. Other thing which will be of utmost importance, and that is radiological anatomy. Radiological anatomy. Why to learn this thing as a separate one, right? Differential diagnosis means when the patient tells that there is pain in abdomen, what are the possible causes of pain in abdomen, and out of which you filter out that this is not possible, this is not possible, and you come up with one diagnosis, right? That is how to differentiate between various diagnoses. That's why it is said that what are the causes of headache? Well, that causes of headache, to remember the causes of headache itself is a big headache, right? But there could be so many causes. There could be brain tumor or there could be hypertension. But then you have to differentiate between those two, right? So where you will see that are there other neurological symptoms from the history itself, you will be talking about and you'll be coming to that conclusion. So that's the reason that when you'll be coming into medicine, again, I'll be giving you some classical points that whenever it comes to any of the disease, congenital, traumatic, inflammatory, neoplastic, miscellaneous, in miscellaneous, immunology, and in neoplastic, benign and malignant, follow this pattern every time and you'll find that any disease becomes very easy to remember, very easy to diagnose, right? Because every point will be having a very specific keyword. Remember the keyword. You will be remembering the keywords and you'll not be remembering the running long sentences. That's why everything will be in the form of keywords. Today, after completion of this session, within 5 minutes, we'll be going for a very high speed revision. This is what I want all of you from today, right? So just before you go to sleep, you'll be going through this PDF at a very high pace, maximum 5 minutes. Don't spend more than 5 minutes. Don't try to cram. But the beauty is, if you go through it at a very high pace in 5 minutes, next morning when you wake up, again go through. And then you'll find that this will become part of you. You don't have to cram, you don't have to remember. Automatically you'll start remembering the things. And it will be very easy, right? So radiological anatomy, obviously it would be like X-rays. They will be the first line of defense. And then we'll be talking about CT, we'll be talking about MRI, right? Yes, CT and MRI, they are also called as the cross-sectional anatomy. This is also one of the type of anatomy, cross-sectional anatomy. You can't cut the patient and then see, okay, let me see what it is, right? But this CT and MRI, they are like invisible radiological knives. They cut the body, right, invisibly, and then the electronically they display on the screen by Fourier analysis, and the image is formed, and then you come to a conclusion. Then later on, we'll see what is 3D reconstruction. So if you find that one particular structure is interesting, so you can actually, with the help of computers, you can create it in 3D and you can actually rotate it. So that will give you the idea that where exactly how this structure is inside the body, and then your report would matter because you will be helping the surgeon that take care of these things, because these are the blood vessels which are very near to it, right? And that's the reason why we say language, because whatever you will be writing, say on phone, right? Sometimes we, what we do on phone, we say कि अरे हाँ वो मेरे घर आना तो फिर ऐसे मुड़ जाना, right? That's what we say. अरे boss, this is not a video call, right? But I have seen people telling like that, right? I was, in fact, on airport only, I was one, that guy was telling, अरे तू ऐसे मुड़ जाना. I was wondering how will he understand. This is the reason why we learn this anatomy language, because you can't say to that surgeon in your report कि बस पास में ही pathology है. No, it has to be precisely say it has to be precisely that at what distance one one organ is there with reference to other organs, so that it makes crystal clear picture whether that object or that structure is exactly into which location, beyond doubt, right? There shouldn't be any doubt. Yes, you can, but you have to go to US because they allow everything. Over here, you can't take admission in PG twice. So this is radiological anatomy, right? Then one very interesting is applied anatomy. Applied anatomy. If this is not there, then entire anatomy becomes very boring, right? It becomes very boring. Because applied anatomy is that where you put into practice, where you put your knowledge into clinical practice. And when it is put into clinical practice, it becomes fun, right? So that is what is called as the applied anatomy. Then from the research point of view, there is like anthropology, right? There is like anthropology in which you, all those fossils are there. You just collect that, okay, how the size of femur is increasing as in different races, in different groups. What is the size of mandible in Africans, Americans, right? Europeans, etc. So all those comparative and anthropology. So which is more or less about the say experiments, right? One another important or interesting thing is that is histology, right? Histology. Yes, this is very interesting. This is what we'll study in depth. It is like you take one specific tissue, right? You fix it. You with the microtome, you take a fine thin slice. You fix it on the slide, and then with the microscope you watch it, right? With the microscope you watch it. The question might be asked that why we are watching things in more detail. We have to examine the patient. Well, this is important for your pathology. People say pathology is difficult simply because their histology is not very clear. Because in pathology, there would be variation of this histology. There would be tissues which will be changing their structure, they'll be changing their size, they'll be changing their shape, they'll be changes in the nucleus, right? So many things would change. So in microscope, when you see, in histology, when you see the normal structure, right? Or we'll be watching all the normal structures. But in pathology, we'll be watching same structures, but with various diseases. So that is where we realize, okay, this is how the normal looks like. This is how the abnormal looks like. When we'll be discussing histology, though it would be too early, but definitely I'll be showing you some pathoslides, not all, right? But some pathoslides. This is to prepare your brain for what is coming up, right? So that is histology. And yes, we do have a very nice this microscope with the camera. So everything will be like a live feed, right? I'll put the slide and then say we'll go for 10x, we'll go for 20x, we'll go for 50x, 100x, right? Oil immersion, everything will do. And that's how, say, we'll study that particular slide. So I'll show you the real slide also, because it is allowed to do the cheating. Some of the slides are like you just watch it and you'll say, it is this slide, right? And then you put it inside so that you see the structures. So both the ways we'll study. And that's where we'll be watching some of the patho slides. Some, not, because it's like if we go for liver pathology, so it will take 10 days to learn the entire liver pathology. It's in so much of detail, right? But at least few slides you'll definitely be watching. And then the genetics, right? Genetics. And this genetics would tell that why you are the best, right? Everyone is best. Now, seriously, everyone is best, because the competition was between 100 million, and there were 100 or 100 million sperms were there, and the best sperm fertilized that ovum, and that best combination is no one but you. Correct? So right from the beginning, you are a winner. Right? When the competition was so stiff, right? It was so stiff, and still you won. So if you are such a strong winner, so then why to worry now? Right? Why to doubt yourself? Right from the beginning, you are a fighter and you are a winner. Right? So good. Okay. So these were the types. Now let's move to something fantastic. And that is history. When we say history is boring, I say it like history is his story. Now it will take only a few minutes before we'll be learning about the history. And why do we learn it? Because then and then we realize that what we are studying today, right? What a fantastic effort was given by so many people, right? And then something has come to us. For us, it is like a prepared dish. They were they were they were like real cooks, right? Apne paas so we have got a prepared dish. It is exactly like ordering on Zomato or Swiggy, right? We don't have to worry about. Yeah, by the way, many of you have say made that brain map of aloo paratha actually very tasty, right? Really, you have added such details. Very nice. Okay, so so instead of going for straight away the prepared dish, let's talk about some cooks, right? Say how they came up with the concept of anatomy. The biggest name, is Hippocrates. Hippocrates. Now he is, because we are studying medicine, so that's why we should know, because he is considered as father of medicine. Father of medicine. Not only that, say for Hippocrates, when you Google, you'll come across so many compliments, right? Because he is considered as say enemy of superstition, or he was considered as pioneer of rationality. Even once you'll become doctor, right? There would be an oath. You have to take an ethical oath. Ethical oath, right? That ethical oath is called as Hippocratic oath, right? This is the oath in which you will say, right? You'll actually say that you'll not be doing any of the unethical things, etc. right? Because it is a public platform, won't say much about it. But well, there is an oath, right? This is quite a controversial thing, right? You should know. You should know. Hippocrates, as such, if you try to go into the details, right? It's like about 400 years before Christ, way back, after MBBS, right? After you complete it. So way back. So that means this Hippocratic oath that's also so old. Yes, that is pretty old, right? But who created it? Actually, there were like 60 scholars. There were about 60 scholars. They till date they were all anonymous, right? We don't know who they were, but they were that is very ironic. They were those anonymous scholars. They were the supporters of Hippocrates, and in this oath, right, we say that, well, you will never entertain abortion and you will never entertain euthanasia, right? That is mercy killing, etc. And still there are few other things also. But the point is, say, why this is called as Hippocratic oath. I was reading a book. If you have heard of a philosopher called Plato, right? Very intelligent guy. He said that his words were very interesting. That it was Hippocrates. If you go into the history, yeah, if you go into the history, it's the island of Kos. Now this is somewhere near Turkey, right? That was where, right? That was where he used to teach medicine, and that's where the Plato used two words. Now see, this is very interesting. Plato used two words. That is what is called as the Asclepiad. 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 That whether Hippocrates was Asclepiad or he was Asclepius. What does this mean? Asclepius and Asclepius. This means these guys, they say that they are God, right? They say that they are God, God of medicine. While Asclepius, they say they are the healer. So there is so much of controversy, and let's not enter into it. But because as a medical person, you should know that we are not God, right? We are healers. Because when person tries to become God, then one thing which enters, and that is the ego. Never do that. We all are healers. And then if you go into the depth, they say that why it is said that once you become doctor, that you should teach sons and daughters of others to become doctor, so that they become better and better. They don't have to reinvent the wheel. You teach them that thing what you have learned, so that they learn it directly and they proceed to a higher level, right? Obviously it is like that. You won't say that chalo, if we want to travel, let's make a car by myself, let's make a bicycle by myself. No, there is no fun in it. Why to waste time, right? Instead, learn from someone's experience and then proceed, right? So this is the concept basically of the actual oath, right? Actual oath. Yeah, doctor symbol is also related to it. That's true. So if he is the father of medicine, so I'll say two, then father of anatomy. But just there are two three names which you should know, because we are dealing into that subject, so we should know, right? So that is Herophilus, Herophilus, Philus, Herophilus. Why so? Because he is the guy, right? Again, very old, about 300 BC, right? But he is considered as the guy who actually dissected, and then he came up with so many ideas. He gave name to so many organs, and even till today, say hyoid bone or duodenum or prostate, right? All those names which were given by him, same names are respected. We'll see that in the nomenclature, in the basal nomenclature, the book which is published with all the names, right? Some names they keep on changing, but some of the names still they have been preserved. So that was Herophilus. One of the very vital name, and that is when I write Leonardo, right? I don't know in which lecture. This it was a live lecture. He said Leonardo DiCaprio. I said no, this is Leonardo da Vinci, right? This is Leonardo da Vinci. He is, whenever you study radiology, yeah, Da Vinci. Whenever you study radiology, remember this guy. One of the most intelligent guy. That's why it is said that say if you want to learn, right? Two things they are said, and this is true. Curiosity, curiosity of Leonardo da Vinci, and mathematical abilities of Albert Einstein, right? They are beyond par. So it's like if you learn from that, right? If you learn from that, so then your life would change, right? So we don't try to compete, but it is like we try to follow it. Because see, Leonardo da Vinci, he's also called as Leonardo da Ser Piero da Vinci, his full name, right? But he was into so many fields. He was an awesome painter, right? Paintings. Then he was a sculptor. He was a very good sculptor. Then his engineering skills, right? They were so good. Medicine, it was awesome because his more than 500 drawings. If you'll see those drawings, you'll understand that to what depth that person has really explained the things. And say when we are talking about Leonardo da Vinci, his famous works, one no one can miss, and that is Mona Lisa, right? Mona Lisa painting. Till today, it is considered as one of the most fantastic painting. And this Mona Lisa, its speciality is you watch that painting. You watch that painting from any of the angle, it would always look like that she is looking towards you and smiling. So many people have tried to copy that painting, but that smile, that actually that delicate painting, Rajnikant, okay, that delicacy of smile, yes, eyes and the smile, that is considered as amazing, right? Let me just, I think I give me a half a minute. Yeah, right. So that is Mona Lisa. Eventually, say, this part, these are the three stones, three stones, and there are so many mysteries in this painting. Yeah. So this was Mona Lisa. Then one another painting, his very famous painting, is The Last Supper. The Last Supper, right? This is also, yeah, bridge behind. The Last Supper. This painting is also very famous because this is the painting in which Jesus is there, right? Along with his 12 apostates, right? Apostates, right? Those 12 apostates, right? His followers. And it is it is considered as, it is that moment when Jesus said that out of these 12, one would betray me, and it would be end of mine. Right. So that's why this painting is, this is actually in one of the monastery of that Santa Maria, right? Milan, Italy, right? He was Italian. So in Italy, in Milan, in one of the monastery, this painting is there. Right. At the end, just remind me, I think I got picture of that also, that monastery. Right. I'll show you. And if you're not seen the movie, right, there is the author Dan Brown, right? The author Dan Brown, and this Da Vinci Code, and from that even the movie came out, right? Nicolas Cage, right? Dr. Langdon, Professor Langdon. So very interesting movie, but quite controversial. So let's not enter into that. But very interesting movie, must watch, because this Dan Brown's this novel, Da Vinci Code, it's in fact banned in many of the countries, right? Yeah, The Secret, Sarah, right? The Secret was Sarah. One another painting it reminds me, there was one other painting which is yeah, yeah, Holy Grail, exactly. I think you have seen that. Okay. One another painting which is Vitruvian Man. Vitruvian Man. This painting, imagine the level of understanding and the intelligence in this Vitruvian Man. He has shown that what should be the correct proportion of the human body to look most beautiful. And it, in this painting, you will look like, it will look like as if it is a mathematical painting, right? So where it is the correct proportions they are shown, correct proportions. And then from this came that for a female, if she wants to look the most beautiful, there came the thing what is called as the golden ratio. Now this is extremely difficult to handle this ratio. But yes, it came from that Fibonacci sequence, right? In nature also, the Fibonacci sequence, that is 1, then 1, the next one is 2. So this starts with 0, right? But then this is 1. So next one is 1. 0 plus 1 is 1. Then 1 plus 1 is 2. 2 plus 1 is 3. 3 plus 2 is 5. 5 plus 3 is 8. 8 plus 5 is 13. So that way it keeps on going, right? It keeps on going. And this is considered as a natural sequence. This is considered as a natural sequence. If you are into share market, right? If you are into share market, so then even this Fibonacci graphs, they are extremely important for prediction, right? And same way for beauty, it is called as 1.618. This is what is called as the phi, which is considered as the beauty aspect ratio, right? So very interesting. And obviously, after all these things, our most respectable Mr. Henry Gray, right? The release of Gray's Anatomy, right? Gray's Anatomy. Now, this Gray's Anatomy, it is our reference book. It is our reference book. So don't try to buy the Gray's Anatomy. Unnecessarily, you'll putting burden on your parents. You can't read Gray's Anatomy line by line, word by word. And if you try to do that, definitely 101% guaranteed person would flunk in the exam, right? He won't be successful because there is so much. There is so much. And at times things will go into so much of detail that you'll start forgetting what exactly are you reading. For simplicity, right? As we are talking about books, say BDC, BD Chaurasia, right? That is definitely a good book. Simple, plain. Yeah, PDF is available, sure. But that's why, but still, my point is that not only the costly, but it is so lengthy, right? It is so lengthy. So that's why we study from that book only when it is necessary. When we'll be studying the subject, when we'll be studying some specific topic, I'll be putting things from Gray's Anatomy, only those points which are needed, right? So that's how we'll be working on it. So for your normal anatomy, BD Chorisia, that is absolutely fine. And as you said, yes, Cunningham malleus, right? Cunningham is excellent for dissection, right? We used to dissect literally as per the steps given by Cunningham. And if you do that, yes, your understanding becomes awesome, right? Inder Beer Singh considered as excellent for embryology because step by step, the way he explains, it is amazing. But well, barring some of the topics, that is where you have to really go to, say, higher books. So our intention will be only this, that whenever we'll be picking up any of the topic, you will be learning from several books. I'll be giving you combination of several books, right? Combination of several books. The point is, you don't have to remember each and every minor detail. No, it is not needed. Please remember, that is not needed. All the books, they will be giving something good, something bad. None of the book is complete in itself because the subject itself is so big, but your foundation should be proper, right? If you miss one or two branch, no one is going to fire you. No one is going to hang you, right? Don't worry, right? But whatever you learn, learn with clarity. You should not make blunders. Remember, you should not make blunders. Minor mistake, they are always permissible because no one is God. Okay. And then as the anatomy developed, so then the CT, MRI, right? Then PAT scan, then SPAC scan, single positron emission computerized tomography, all these new modalities, they kept on coming. And this entire thing is developing. Now, if you really want to write a report, right? So that's why we need to learn the language of anatomy. See, anatomy is so rich. It is a contribution from so many people, right? Contribution from so many people. By 19th century, right? By 19th century, there were 30,000 terms. 30,000 terms. And is it necessary that you should remember all of them? Well, not necessary. Right? Not necessary. You keep on learning them literally like a language. You keep on learning them as you progress. But some basic words, basic foundation, basic concepts, very much needed. So that's why from these 30,000 terms, BNA was launched. What BNA is, it is called as the basic names of anatomy, right? It is basal nomina anatomica, but in simple words, it is basic names of anatomy, right? You don't have to remember that Latin full form, but if you remember it like this, so it is about having 5,000 words. Trust me, within next 15 days, you'll be remembering about 1,000 words. And then you'll find that those words, they are getting repeated. There are few principles. If you remember just ectomy, right? If you remember word ectomy, you have automatically learned more than 50 words because it is ectomy means to cut and remove. So when it is said pneumonectomy means pneumo means lungs. So lungs removed, right? Tonsillectomy. So that means tonsils cut and removed. Correct? Cholecystectomy. Cyst means something which is like a bladder. Chole means it is a gallbladder. So gallbladder has been removed. Easy, right? So that's how we'll be learning all of them. This is just for example. So at times, you just learn one word and then you become comfortable with more and more words. And as you use it, same way like language. If you want to learn Spanish, right? So what will you do? You'll start communicating into that language so that it becomes part of you. The way one not one but about 3 4 emails were there, that in between, can you explain in Hindi also? I can. I don't have any problem. So whenever you have got any problem in understanding, straight away tell me. I'll explain at that point in Hindi. But the whole lecture to can't be taken in Hindi. True. And one another thing, the question which is asked is English compulsory? Yes, gentlemen, English is compulsory. English is compulsory. I really want that you start speaking English without any hesitation. You can't learn swimming without jumping into water, right? The question which was asked, that can we learn English just by watching English movies? No, no. You'll start understanding English. But for speaking, you have to jump into water. You have to speak. The moment you speak, that himmat will come, right? That confidence would come. And then gradually you'll become comfortable with it. But yes, you have to speak. You have to speak. No option. Okay. Coming back to this basic names of anatomy, there are few principles. There were 6 very good rules. Now we are like Indians, or it's very fast. Well, doesn't matter. Every country has their own dialect, so it varies. It varies. You become comfortable once you hear. You become comfortable. Not everyone can speak that fast English, and in fact, we Indians speak the most correct English. Right? Many times these other countries, they speak English in which there are lots and lots of grammatical error, but doesn't matter. Doesn't matter, right? So coming back to this, because see, your idea is to go for USMLE or PLAB, right? That is where your communication skills will actually be assessed. So why not to make a very good habit right from the beginning, right? Right from the beginning. You should be absolutely clear with your ideas. You should be able to convey. But that's what is needed, right? I am not telling you become Shashi Tharoor. Okay, coming back to 6 rules. Each part, right? The rule number 1, every part is given one name. Every part will be given one name only, right? This is very vital. Obviously, all of them, they are into Latin or Greek language. Now, these languages, when we'll be learning about the muscles, right? So I'll also tell you that what is the name of that, the name of the muscle, and what is the meaning of that muscle. Immediately it would click. Yes, yes, yes. Say for example, if we say biceps, right? Biceps. So seps means head. Bi means 2. So it is a muscle who has got 2 heads. So what about triceps? Now you know, right? Now you know that what is triceps? That means triceps will be having 3 heads. Correct? So easy, right? So that's how. No, everything is over here. Nothing like private class. Everything over here, right? So that more and more friends they can learn. So that is Latin, or in Greek language it is. These names will be short, right? They'll be short, simple, plain. And one very interesting thing is the memory sign, right? What is memory sign? Close your eyes, and if I say table, so then you immediately, that picture comes, okay, it is a flat area and it is with those legs, right? So this is what is called as the memory sign. All these muscles, their name would be such, if you understand their meaning, because this is with reference to Latin or Greek. Sorry. So if you understand meaning of that word, immediately it would come up like, okay, this is the biceps, and in which there is one long head and then there is one short head. So that's how it has got 2 heads, right? Exactly, it will go like this. I think I have to block this. Can I? How to? Just a minute, just give me. Right. Yeah, spammer. Exactly. So coming back to this memory sign, I love this point because see this thing, right? This point, when we'll be learning anatomy, it will make entire anatomy a fun. At the same time, it will become very easy, right? Second, words would be related. Related in the form, say, say if we talk about femoral, so then there will be femoral artery, femoral vein, femoral nerve, right? It becomes much easier. It becomes much easier. And then we'll be adding. So this is like rule number 3, rule number 4, rule number 5, and rule number 6 would be some adjectives will be given. Adjective means a word which is adding some speciality of that subject, right? So it would be a few muscles. This was like say psoas major and psoas minor. So I always say that they both are cousins, right? Psoas major and psoas minor. So they will be, their function would be similar, but one major would be bigger, minor would be smaller, right? Simple as that. Say some muscles will be like superior and inferior. Superior means above, inferior means below. But let's say in eyeball, superior oblique, inferior oblique. So clear, right? They will be oblique muscles. Superior rectus, inferior rectus, right? Rectus. Rectus means someone who is straight, right? So this is a small muscle which is, this is the eyeball. On the above side, this is superior rectus, so it is above and a straight muscle. This is inferior rectus, which is below and it is a straight muscle. This is the superior oblique, which is above and it is at an angle. This is inferior oblique, which is below and it is at an angle, right? So exactly that thing would follow. And this is now, since 1968, things have been almost standardized, and that is what is called as the nomina anatomica, right? Anatomica. So there are so many other things like nomina, embryology, etc. But that's fine, right? Or basically, all of them they are talking about the nomenclature, right? Now, so when we were talking about anatomy, the first question which is usually asked right from the beginning in any of the viva, that what exactly is anatomical position? What is anatomical position? Because with reference to that anatomical position, you will actually be explaining the entire body, all the structures, all the systems. Otherwise, if I say left side, so left of whose? My left or your left? Right? No. In anatomy, in medical science, not in anatomy, but in medical science, there is no scope of confusion. It is crystal clear. Everything, whatever is written, the moment you read that report, there is no doubt, right? There should not be any doubt. So that's why we'll be learning now. First point, there are only 6 points which are to be learned today. And that's it. That will make the complete picture. And tomorrow we'll be starting from this point onwards, right? Don't worry about the eye part, right? Because there are so many other muscles also. Yeah, but still, because if you are asked, right? Say this is the eyeball, right? And in eyeball, this is superior. Superior means above. The muscle which is straight, it is called as rectus. Rectus. So superior rectus. Muscle which is below, it is inferior rectus. So it tells the shape. right? Just the name of the muscle itself is telling that superior rectus, inferior rectus, medial rectus, lateral rectus, 4 muscles, right? And then there are 2 oblique muscles. Done, right? So how easy it is that in eyeball there are 6 muscles, 4 muscles are straight, 4 muscles are oblique, correct? And straight muscles they are called as rectus. So superior, inferior, medial, lateral. We'll be talking about medial and lateral within few minutes. Oblique, superior oblique, inferior oblique. Done. 6 muscles over. And these are the 6 muscles which are handling the entire eyeball, your movement of eyeballs. Right? So names, all muscles, they are having very classical name. Very classical name. So erector spinae, the muscle which is keeping your spine erect, spine straight, right? How good the name is, right? Trapezius, that muscle which gives shape to your shoulders, right? That's your head, and that cut, that is by the trapezius. But see how wonderful. On the back side, if you see, this is the shape, kite shaped trapezoid, right? It's a kite shape. It's a kite shaped muscle. So when you'll see these muscles, you'll be fascinated that how beautifully the names are given, right? Small muscles, but they will be having very clear name. You remember the name and you'll find that where exactly it is, right? So more as we'll talk about those regional anatomy and the systemic anatomy. Okay? So coming back to this anatomical, just one image. Let me put one image, and that should be sufficient to explain everything. And that is here it is. Yeah, let's put it here. Okay, this is called as anatomical position. What anatomical position is? You have to remember few points. One, anatomical position is always in standing. So when you are standing in viva, so it used to no, not supine. Please stop. Right? I'll come to supine, prone, everything. First, understand this. This is not supine. This is standing. Remember, you will be in viva. It is many times said that okay, stand in anatomical position. So you are standing. Second, eyes straight. You are watching in front, eyes straight, right? So that head is steady. Arms on side, right? Arms on side. In what way? Palms open and thumb, they are pointing outwards, right? Palms facing front, right? So automatically those thumbs, they'll be facing out. Palm facing front, right? And feet together. So as such, though, if you just watch this, shouldn't be that difficult, right? So one person is standing, then second facing front, right? These are the arms on side, hands, palms they are facing forward, and feet they are together. This is called as the classical anatomical position. So whenever we'll say that this thing is in front or this thing is in back, it is with respect to anatomical position. Now what you have to remember is that when you'll be doing dissection, yeah, mouth closed. When you'll be doing dissection, your cadaver is lying. When you are doing surgery, your patient is lying, right? The patient is lying. So then there comes, so this is first position. So now we have got 2 more positions, and that is one is supine. Exactly the same way, just let the patient lie on his or her back. So supine means soya hua, right? So here is the patient and that's the nose. But this is supine. Correct? That's 3. The reverse of it is prone. So that's the patient, and here is the nose. Right? Patient is lying on face. So that is what is called as the prone position. Why so? For surface anatomy, right, many times cadaver would be upside down, that is in the prone position, and then it would be said that, okay, show me the surface anatomy of left kidney, and that is where you have to mark on it, right? Because kidneys, they are retroperitoneal structure, right? Because they are in the back. So in front there is stomach and intestines and everything. So you remove, and then finally as you reach to the back, that's where the kidneys they come, right? So that's when we'll be discussing the abdomen. You'll come across all these names, but this is how it goes. And finally, one very important position, which is called as the lithotomy, right? Lithotomy position. In lithotomy position, say a patient is lying, but his legs, they are raised, right? And either they are strapped or supported, and this is when the delivery of the baby is to be carried out, right? For the delivery of the baby. So here the patient is in supine position and the legs raised, strapped or supported, and that's lithotomy position. Okay, let me save this, right? So that I can send this. All right, saved. Now we'll talk about just last topic of the day, right? And then there are a few small things which are associated with it. Then we'll go for the full revision at a high speed revision, because tomorrow we'll be starting from the point where we will stop today. We are talking about planes. Planes. That's the head. We are watching from the top. This PDF would be saved. It will be kept in Google Drive, and the link will be into the comments also, right? And the description also, I'll put the link so that you can download it from there. So here is the head. You are watching from the top. So then where would be the nose? This is the nose, right? Are you with me? Right? We are watching from top. See, as you will be more comfortable with say medical terminology, this thing would be piece of cake. But initially, some confusion occurs. So first thing I would say, how will you wear a crown, right? So a crown, right? It is like this, right? A crown. Correct? Crown will be like this. And remember, crown, and from crown we are coming to first word, and that is coronal. This is coronal plane. Coronal or crown, that means coronal plane means it is horizontal, right? But over here, horizontal means it is going from one point. This is a top view, right? Remember, it is a top view. So this coronal plane is dividing the body into anterior part and the posterior part, front and the back. Am I clear? Am I clear? Right? There are just 3 planes which you have to remember, and then rest of all the description, they are based on this plane, right? They are based on this plane. So when I say the coronal plane, so it is exactly like this. It is cutting like this from left to right in the center. So anterior body and the posterior body. That is how it is divided, right? So this plane, if I consider, right, this is like this, right, and the body is there. So the whole body would be divided into anterior part and the posterior part. True? Just a minute. Yes, yes, it is the head which is seen from the top. That's right. It is head which is seen from the top. And that's why when our head is like this, right? Whenever head is like this, when our head is like this, so we wear the crown like this, right? It is from side to side. Right? Yes, I'm coming to that. I'm coming to that. Just this step by step. It will take just 3-4 minutes and it will make everything clear. Right? So remember, we started our journey with the crown. We wear the crown like this, right? Crown is like this, like this. So it divides the whole body. It divides the whole body. This is the coronal plane, right? This is the coronal plane. Divides the body into anterior half and the posterior half, right? That's where the cut is like this, right? That's the cut. Got it? So this is one coronal plane. I hope this plane is clear, right? So that's the head. This is the nose. This is coronal plane. Coronal plane. Okay, this is the coronal plane. So then a plane which is dividing like this, right? The nose should be like this, exactly passing from the center. Exactly passing from the center. This is called as the sagittal plane. This one is sagittal plane. So sagittal plane will divide the body into which part? Right half and left half, correct? So right and left, it will divide the body because now it will go like this, right? It will go like this from the center, right? Back to front. So it will divide the body into right side and the left side, right? So that's how it is divided. But once this is clear, the third plane is the easiest one. Here is the body. Yeah. The way we cut the lemon, it divides between the two equal halves. Can I visualize coronal plane by this? Well, Deepak, say the lemon is there, right? So if you cut it like this, right, like this, so it divides into anterior and posterior, right? So then it is coronal plane. If you divide it like this, so it splits into left half and right half, right? So then it is sagittal plane, right? But because we are working in 3D, human body is not a 2D structure, it is a 3D structure. So here is the body, right? Legs, right? When the plane is passing like this, when you slice it, right? When it slices like this, right? So that is very logical. It is called as the horizontal plane. Easy. It is called as horizontal plane. So all CT scans, right? Here is the gantry. Here is the gantry. Patient is there, right? Patient is lying, and the cut sections they would be taken like that, right? So section, yes, nose would be cut into right and half, right and left in the sagittal plane. Perfect. Perfect understanding. And when we'll be learning head and neck, right? When we'll be learning head and neck, so at that time the cut would be coming like this, right? And then we'll see the head from one side, and that is where we'll see all those concas, etc. Right? Yes, we do have a sagittal suture also, right? These are the sutures, right? Sutures, they are the joints. We'll be discussing in more detail when we'll be talking about the joints, but yes. Right? So this is clear, right? Axial, right? So this horizontal plane, that is the plane in which most of the CT and MRI images, as if this is the body and you are cutting it, right? You are cutting it and then you are watching it. So these are the three planes: sagittal, coronal, and horizontal. Now, if you have understood it, rest of the terms, they are completely easy. See, within few minutes, you will understand all of them. One, what is called as the ventral, right? Ventral is nothing but anterior. Ventral is nothing but anterior. Dorsal, dorsal is nothing but posterior. Posterior. So, ventral is anterior, right? We write with straight lines, right? So you never dorsal, so a curved line. Writing posterior also, there is a curved line. So they make a pair, right? So remember, when we say this is in the ventral region, that means we are talking about it is into the anterior region, correct? This is super easy: superior and inferior. Superior means which is above, inferior which is below, right? You will also come across the word cranial and caudal. Cranial means it is towards head, right? It is towards head. And this is towards tail. That means away from the head, right? Then superficial and deep, it is self-explanatory. Superficial and deep, right? So when you will be, yes, caudal is tail. So when you will be discussing that, okay, let's first remove the skin, right? When you remove the skin, there would be fascia, a fat layer, right? So this fat layer, it is in two parts. So there would be superficial fascia and there will be deep fascia. So immediately it makes it clear, yes, after skin, there is superficial fascia, you remove it, and then comes the deep fascia. And this deep fascia will be playing so many roles, right? Another one, when we'll be learning some neurons, at that point, this thing will come into picture. Ipsilateral and the contralateral. Contralateral, yes. Ipsi means same. So here is the body, right? That's the midline. Two structures are here. So this is structure A, this is structure B. So A and B, they will be considered as ipsilateral. They are on the same side, correct? There is one more structure C, which is over here, right? Contralateral means opposite side, right? So A and C, they are contralateral, right? So that is how it is explained: ipsilateral and contralateral. Now, the heaviest used words would be medial and lateral. So here is the body. This is midline, right? This is midline. Which plane? Sagittal plane, right? So that's a sagittal plane. This is also called as the median, not the medial. It is median plane, right? Which is exactly into the center. Now there are two structures. This is one, this is two. This is A, this is B. Medial means it is always a comparative thing. You are comparing, right? Because none of the structure can be independently medial or lateral. What exactly I mean to say is this. My statement would go like this, that A is medial to B. This means what I'm trying to say, that A is more near to the midline, right? This is our midline. Midline is also called as median. Remember, median plane, right, is also called as sagittal plane. So it means when we are comparing two structures, this is more medial, right? Medial and lateral, they are for comparison, comparative, right? They are comparative, correct? So in other words, we can also say that B is lateral to A. It's one and the same thing. B is lateral. Lateral means away from the midline. This means near the midline, and lateral is away from midline or the far from midline. Correct? So that's how A and B, they will be defined. Which one closer than the other? No. Comparison is with respect to midline. Remember, comparison is with respect to midline. Let's make it still more clear. This is the body. This is the midline. There is one structure. There is second structure. This is third structure. Let's call it A, B, C. Right? A, B, and C. So, which is questions? Which is the medial most structure? Medial most structure? Which one is the medial most structure out of A, B, and C? In other words, which structure is near to the midline? Right? A. Obviously, it is A. Done. If I say which is the lateral most structure, right? That would be, lateral most would be C. That's right. But now, okay, perfect. But what if I say, I'm just changing the word and see what happens. There would be lots of confusion. Which is the, right? Someone wrote A. A for what? A for lateral most? No. This is medial most, correct? And B is medial for A and C. B is medial for A and C? No. Wait. Coming to that. My next question is, which one is medial structure? Now this is a problem. Which one is medial structure? Right? With respect to whom? Right? Because see, B, but B can be lateral also. Hai. See, A, B, confusion comes. Yeah, that's right, Deepak. B is medial to C. A is medial to B and C. Correct? Listen. Am I clear? Right? These two structures, they are medial to C because it is a comparative thing. Correct? It is a comparative thing. So medial structures with reference to C, so then they are A and B. Perfect. But what if we change our reference? Medial structure with reference to B, so then we have got only one structure and that is A. Correct? So that's right. Right? Same way, if I say which is the lateral structure. So lateral structure, that would be with reference to whom? Right? With reference to whom? So with reference to A, it would be B and C. With reference to B, it would be only C. Correct? So remember the difference between median, that is the midline, right? And medial and the lateral, they both are relative to each other. Correct? Perfect. Then these two words, invagination and evagination, these words, they would be used extensively in embryology, because in embryology there will be formation of so many structures, and when the cellular movements will be there. So here is say if anything is going inside, it is called as the invagination. And if it is protruding means it is going out, so it is evagination, right? It is exit, this is in, right? Invagination and evagination. So these are the few words which we remember. Now, as we'll be learning about the various planes, right? When we'll start with the dissection, when we'll be going for the systemic, when we'll be going for the regional anatomy, right? Actual dissection. So always you'll find that arrangements, they are very specific. Arrangements. There would be bones. So our method would be that first we'll start with bare bones, right? Let's put one bone, right? Let's put another bone, form a joint. On that, let's put some muscles so that we learn how these muscles move. Then let's put arteries, nerves, veins, right? So that we make it rich. And then start wrapping it with the fascia and finally the skin. So that way we'll construct all the organs. So it will create that visualization, that picture in our mind, right? So these would be the layers: bones, muscles, then all those blood vessels, nerves, lymphatics, right? All those small vessels, etc. Everything would be there. And then, because we are going from inside out, right? So there'll be deep fascia first, deep fascia. Then there would be superficial fascia, right? Superficial fascia. And finally, the skin, right? And when you do the dissection, you'll really appreciate that the beauty is just skin deep. The moment you remove the skin, everything becomes same. Everything is same, right? So this is the order. This is the order which will follow, right? Bones, muscles, blood vessels, nerves, lymphatics, deep fascia, superficial fascia, and the skin. So during our entire anatomy journey, this would be the order. Now tomorrow, because we'll be starting with bones, right? So we'll see that what are the various articulations, how they actually move, and tomorrow you'll be learning another 30-40 terminologies, right? So this will be, and this has been saved, right? So this will be our pattern. Oh yeah, that's true. And especially when you will be learning thorax, trust me, thorax, abdomen, and brain. At one point you will definitely say that what an amazing masterpiece God has created, right? Such beautiful organs, they work with so much sincerity and dedication. Right? So this was for today. Now let's go for literally 5-minute revision, right? 5 minutes. Systemic means when we are dealing with bones. Angiograph means bones, muscles, right? Blood vessels, then organs. So that is how we go for. A is medial to B and B is medial to C. That's right, Shravan. You are right. Aryan, for books, as I said, say BD Chaurasia is very good, right? Is absolutely fine, right? Subjects of first year are anatomy, physiology, and the biochemistry, right? I'll do one thing, right? There are several books, so I'll just add names of the few books in this PDF only, and I'll put it, right? Yeah, that is also a good book, but say most of the books PDF they are available, right? They are available. So keep one book which is crystal clear, crisp, easy to remember, and then you can always keep on remembering, adding other books. So if you get say more points from it, right? Okay, so let's revise the whole thing under 5 minutes, actually under 5 minutes. And this is the habit which I want you to cultivate, right? I'm starting the stopwatch now. So that's the general anatomy. Anatomy, to see, to cut, that came from the word Greek word anatom. This is cadaveric, regional and systemic. Regional, upper limb, lower limb, thorax, abdomen, head and neck, brain, right? And in systemic, you are dealing with the bones. Osteo, myo is muscles, angio means blood vessels, arthro means joints, neuro means nerves, and splankno, a new word, remember, it is organs. So respiratory system, alimentary system, endocrine, cardiovascular, all of them, right? In the living, inspection, palpation, percussion, auscultation, right? This will be helpful even in the medicine. Inspection to watch, palpation to touch, percussion means knock knock, and auscultation, that is when you use your stethoscope. Endoscopy, all various types. Embryology, prenatal, that is before birth. Ontogeny, this is, we write it like zero, development from zero, right from the beginning. Phylogeny, this is for the evolutionary study. Surface anatomy, name itself is telling everything represented on the surface, right? Would be very important for the differential diagnosis. Differential diagnosis means you touch the patient and you should know that what are the structures which are going inside from this point. So that will help you a lot in the diagnosis. Radiological anatomy, X-ray, CT scan, MRI, basically cross-sectional anatomy, as if you are taking a section of the body and then you are trying to identify the structures. We'll be watching as we proceed as per the say organs or as per the region, the cross-sectional anatomy, right? CT and MRI. Applied anatomy, putting into clinical practice. Anthropology, that is when we use all those fossils for the various measurements, and and all those structures with various races. Histology, that is when we see the slides. Genetics, you are the winner, you know it, right? History, Hippocrates, Hippocrates was the father of medicine way back 400 years BC. That is the oath. And the Plato who has worked on it. And this is Asclepiad, that is those who consider themselves as God. And the Asclepius, that is, they are the healers. Father of anatomy, Herophilus, right? 300 BC, Herophilus. Hyod, duodenum, prostate are the name given. Leonardo da Vinci, a genius, right? Mona Lisa, Last Supper, the Vitruvian Man. Yeah, these are some very famous. Golden ratio, basically it is a Fibonacci series. Henry Gray, a great anatomist, Gray's Anatomy, that would be our reference book, right? Then CT, MRI, PAT scan, language of anatomy. So 30,000 terms, but this is basic names of the anatomy. 5,000 names, they have been restricted. 6 rules, that is one name would be given, Latin in, right, Latin or the Greek. Short memory signs, they'll be all related. Adjectives would be given, major, minor, superior, inferior, so that it is easy to understand. Nomina Anatomica, 1968. Position, first one, anatomical position, standing, eyes straight, arms on side, palms facing front, and feet together. Watch the figure and you know it, right? Rectus and oblique, they were as an example. Supine, person is watching the sky, right, lying on his back. Prone, and he is ulta, right, on face. Lithotomy, that is for the delivery of the baby. Planes, we started with crown, right, that is the coronal plane, side to side. It is dividing into anterior and posterior, right. Then we have got sagittal plane dividing into right half and the left half, right and the left. And the horizontal plane, which is dividing the body into upper part and the lower part, right. That is the horizontal plane, and that would be useful when we'll be going for CT, MRI, etc. Ventral, anterior, dorsal, posterior, superior, inferior, superior above, inferior below, cranial above, caudal below, superficial, deep, it is easy, ipsilateral on the same side, contralateral on the opposite side, right, they both are on the opposite side. Comparative, medial and lateral with respect to median plane or the sagittal plane, center one. So now you know it, that this is medial with respect to B, right? Same way we saw one more example, ABC, right? The A is relatively medial to B and C, B is medial to C, and C is the lateral most. Invagination, evagination, and finally the arrangement, bones, muscles, blood vessel, nerve, lymphatics, deep fascia, superficial fascia, and skin. 4 hour, 54 seconds. 4 minute, 54 seconds. Done. Right? So this is how every day you'll be going for the revision. Now see, first time it will take about say 5 minutes. 5 minutes. Next time when you'll revise, it will take 3 minutes. So every day you keep on revising like this, right? Your speed would not only improve, but at the same time, you'll start remembering it crisply. Okay. Regarding the books, I'll write few more details in this PDF only, right? I'll write few because it is your choice, but I'll give you my choice, that what I used to read, right? So I'll divide it into this way, that books to be read and books to be read and the books which are the reference. So books which are to be read and books which are for the reference, right? So I'll write it in this and will send it to you. All right. See you tomorrow, same time. And thank you so much. Preferably, right? Preferably, because if they have done so much and then there are not much of the names, just very few names are there. So yes, I feel like that it's worth remembering. Okay. Thank you so much and see you tomorrow. Bye bye. Shift away from, okay. We'll talk about it. Means I won't say that you should shift yourself from physical books to only digital books, but you should be comfortable with both. But as we are more comfortable with physical books, but I'll show you how to be comfortable with even our digital books, right? I'll show you a live example. Tomorrow or day after tomorrow, I'll do that. Last lecture's PDF, it has already been shared. Its link has been placed about USMLE and PLAB exam. In just one PDF, that is the USMLE PLAB final. That is like a name in which everything is there. Yeah. Yes, dedicated. Good name you have selected. All right. Thank you so much and see you tomorrow.